be talking to Dr. Ogura and Dr. Subramanian about sleep, right? Is there a more important topic? We can't do anything without sleep. Any of us, especially people with Parkinson's. So I will now turn it over to our host for today's program, Dr. Subramanian, and let the two of you take it from here.
So welcome everyone again. Hope people are hanging in there and doing well, staying healthy, staying in their homes. We wanted to bring you some information about sleep because it's just so important in general. It's such a big topic in Parkinson's disease. A lot of our patients have insomnia at baseline. Sometimes they have excess daytime somnolence. As people age, sometimes we have disruption of the sleep-wake cycle, and people tend to sometimes stay up at night and be sleeping in the day. And so this is a problem in general, but in this COVID time era when people are really having disruptions in their scheduling and stressed out and anxious, I think that this has magnified sleep issues for not just our patients, but all of us. And people have described, not being able to sleep through the night, feeling sleep deprived, and just sort of generally kind of tired. So I think this is a really great topic. And Naoya, who I just have met over this forum, but works closely with Julie Hirschberg and her team at Reactive Physical Therapy, has been kind enough to join us. We were actually supposed to do a live session for Reactive, I think just this past Saturday, that got canceled because of the COVID issues. And so I look forward to hearing him speak about this passion of his. He's been interested in sleep and as well as anxiety and stress relief. And so I think these are all great topics to discuss. And he's going to have some slides for us as well as take some question and answer at the end of all of this. So we look forward to hearing you. Welcome.
Thank you. Thank you for having me. It's good to see everyone. I know I've been reducing my social interaction a lot, and so it's nice to meet new people, even if it's just through Zoom. I think y'all brought up really good points about how crucial sleep is, how important it is, and how it can be difficult to maintain good regular sleep, especially during times like this. So hopefully some of the information that we go over today will be helpful for you in getting a little bit more rest. I do have a slide or a PowerPoint slide. So let me present it and let me try sharing it, see if it works. So here and present. How does that look?
Perfect.
Good. All right. So today's presentation, the title is Optimizing Sleep, Non-Pharmaceutical Approaches to Getting More Rest. Just to get started, some introduction. So my name is Naoya Ogura. I am an occupational therapist at Reactive Physical Therapy and Wellness. We have two clinic locations, one in West LA and one in Torrance. Both of them we're not really doing in-clinic visits for obvious reasons, but we're still continuing with some online sessions, online group exercises and whatnot. So we're still active, and at Reactive, I am the occupational therapist, but I'm also the lifestyle therapy specialist, and which is why I'm working with sleep. Those of you who have worked with occupational therapists in the past, you might have worked on arm exercises, like fine motor skills, things like that. And I do that as well, a lot of self-care skills and whatnot. But I'm also working on lifestyle therapy, which I think is important for any chronic conditions, but especially for Parkinson's and other neurological diseases. So lifestyle therapy, just to explain what it is, it's based on this idea that things that we do on a day-to-day basis can have a pretty significant impact on whatever disease process it is. So the way that we are eating, the way that we are sleeping, the way that we are exercising, and how we take care of our mental wellness can impact the severity of the symptoms. And all these things, I like to work on them together because they do interact with each other. Having healthy eating can help with exercise, can help with your mood, and vice versa. So in terms of what sessions look like, it's very similar to health coaching sessions. If you ever heard of health coaching or seen health coaching done somewhere, The process is basically learning about healthy habits, which you'll be learning about sleep today, analyzing your current habits, planning how to get healthier by making action plans, executing your plan, and then working on maintaining your plan. So to put simply, like it's basically about becoming a healthier person and coming up with healthier lifestyles to help optimize your health. And this is really important because, especially for sleep, sleep impacts and is impacted by other lifestyle factors. So these are just some examples of different ways where sleep can interact with your different lifestyle domains. But for example, if you start having better sleep, it can give you more energy, which makes it easier to exercise more, which in turn can increase your sleep. There's some research on how better sleep exercise can improve your sleep quality, sleep durations, and whatnot. Similarly with mood, better sleep can improve your mood during the day, which can reduce your depressive symptoms, whether it's anxiety or depression, which can also improve your sleep. And finally, better sleep can improve your dietary hormone regulation. So within your body, you have two hormones, leptin and ghrelin, and they are impacted by your sleep cycle. And when your sleep is thrown off, your body will start craving like higher density, less healthy food. But if you are getting enough sleep, it might be easier to maintain a healthy diet, which can reduce some sleep apnea symptoms if it's due to being overweight, or it can reduce some joint pain problems, whether it's low back pain, knee pain, if it's related to increased pressure in those joints, which can also in turn improve sleep. So you can see how this causal chain can go in so many different directions, which I think is why it's important to think about your lifestyle as a whole and to take a really holistic approach to managing whatever condition that you're having. This is a pyramid that I like to go over when people are first introduced to lifestyle therapy and thinking about the different tiers of why healthy routines are important. So at the very top of it, healthy routines can improve Parkinson's outcomes, especially exercise. There's a lot of research on how exercise can slow the disease progression in Parkinson's. So there's a primary benefit to these healthy routines. But at a secondary level, healthy routines can also reduce your risk for other diseases. So whether it's things like diabetes or back pain, other types of pain, fatigue, depression, anxiety, if you also have Parkinson's and something else, obviously you have more things to deal with. There's a lot more that the body has to do. And so healthy routines, whether it's eating, sleeping better, exercising, or managing your stress, can really improve your quality of life that way. And at the very bottom, foundationally, healthy routines are good for general health, even if someone doesn't have clinical diabetes or clinically diagnosed depression or anxiety. If we are eating better, exercising better, it's good for everyone regardless of our condition. So in general, these healthy routines are important for promoting health. So today we'll be talking specifically about sleep. So I have a slide here about how common it is for people with Parkinson's to have impacted sleep. So by some research, up to 50 to 81% of people with Parkinson's report sleep problems. And this can include things like sleep fragmentation, which is not getting consecutive hours of sleep. Increased wakefulness after sleep onset, which basically means being up at night in the middle of the night, whether it's 3 a.m., 4 a.m., frequently waking up at night. So 80% of people with Parkinson's report 2 to 5 awakenings per night. Impaired REM sleep, which is the mentally restorative stage of sleep. And sleep can also be impacted by Parkinson's medication. And as I got into work with people with Parkinson's on sleep and other lifestyle factors, I do keep seeing this a lot where people are coming in and saying, I'm able to fall asleep, but I wake up after 2 hours, or I have a hard time falling asleep. Some days I can't sleep until 3 a.m. Like there's a lot of variation in how sleep can be impacted. But this is really just to say like you're not alone in all of this. I know sometimes it might be a little overwhelming to see how sleep is impacted by Parkinson's. It's not just purely insomnia in some cases, but the good news is there are a lot of things that we can try to improve your sleep and give you a little bit more energy during the day. So how do we treat sleep? There's a lot of different approaches to sleep. This is really just an overview. I kind of summarize a lot of things here. But I categorize them into medication, like treatment through medication, which are managed by doctors, MDs, CPAP machines, which are basically these masks that you wear if you haven't heard of these before. This is helpful for any sort of breathing difficulties, obstructive sleep apnea, and these are managed by sleep study specialists, people who help set up with the correct settings for those devices. And then in terms of things that I do in OT, pain management, circadian interventions, and cognitive behavioral strategies. These are the three areas that we'll be talking about more in depth today. Just to give you a brief overview of these different types of interventions, pain management, if you are having any sort of pain at night when you're lying down or towards the end of the day, that can interrupt your sleep quality or sleep duration. So we might work on reducing those symptoms so you get better sleep. Circadian interventions. So if you haven't heard of circadian rhythms before, that is your biological clock. Biological clock meaning there's a part of your nervous system that tells you what time, if it's morning or if it's nighttime, if you should be getting sleepy or if you should be awake. And if that clock is kind of thrown off, if it's not regular, it can become very difficult to get good sleep at night. So the circadian rhythm interventions are focused on resetting your clock so that you're able to get pretty good sleep at night. CBT, that's cognitive behavioral therapy for insomnia. This is coming out of psychology studies, and it includes things like going over sleep hygiene, sleep beliefs assessment, and sleep routine modifications, which can include sleep restriction and compression, but we'll be talking about that more in depth later. Okay, any questions so far from anyone?
No, I think it's great.
Doing good? All right. So before we dive into what you can do about sleep, we'll talk about what happens during sleep, kind of understand the reasons for sleep and what's happening. So this is describing the 4 phases of sleep. So sleep isn't just an on or off state. Like you don't just go to sleep and it's the same throughout the night. Your brain actually goes through different phases of sleep. And I'll talk a little bit more about why it's important. Largely speaking, your sleep phases can be categorized into REM sleep or non-REM sleep. REM stands for rapid eye movement, and it's called that because when you are in REM sleep, your eyes are moving rapidly, so it's a pretty straightforward naming there. And then non-REM sleep, that's sleep that's not your REM sleep. Your non-REM sleep is approximately 75% of your sleep. REM sleep is about 25% of your sleep if you are a healthy adult. The non-REM sleep can be divided into 3 stages. They used to have 4 stages, now they change it into N1, N2, and N3 for the non-REM sleep. So stage 1 or N1 sleep, that's very light sleep. And this lasts about 1 to 5 minutes in typical adults. This is when you are just about to fall asleep. You might experience a little bit of like twitching or muscle jerks. So this is as your body is transitioning into deeper sleep. N2 or stage 2 sleep happens when your heart rate and blood pressure drop a little bit more. There's a gradual increase in duration of N2 sleep over the course of the night, up to 50% of sleep time. And this is more of your restful sleep. N3, which used to be known as stage 3 and stage 3 and stage 4 sleep. This is your deepest and most restorative sleep. Some people will not wake up even with loud noise or if they're shaken. So this is when you are like out cold, completely asleep. Your brain is, you just won't be able to come out of sleep easily. This is also when tissue growth and repair happens, bone and muscle repair happens, and this stage of sleep is associated with strengthening of your immune system. So this is a pretty crucial stage for your body to repair, readjust, make sure that it's ready to function the following day. And in general, older adults with or without Parkinson's spend less time in N3 sleep. So this is one of the changes that can happen with age. In terms of REM sleep, this is about 25% of your sleep. This happens about 90 minutes after sleep onset, so when you first fall asleep, and it happens about every 90 minutes. This is your dreaming stage of sleep. So if you remember any sort of dream from the night before, you had that dream during the REM stage. During the REM stage, if you are a healthy adult, your muscles are relaxed, your body isn't moving. And REM sleep can start from initially about 10 minutes, but as the night progresses, it can be as long as 1 hour. And REM sleep is important for improving your mood and also your memory consolidation. So I talk about all these different stages of sleep because I wanted to show you this graph. So on the left side, the top is for young adults, so healthy young adults, and then bottom is for the elderly. This study wasn't for people with Parkinson's specifically, but I think the information is still relevant, so I brought out the visual. You can see on the left side, you have different stages of sleep. So at the very top is being awake. You see the REM sleep, that's a little bit of the black line. Then stage 1, 2, 3, 4, they're still using the old labeling there. So you can think of it as N1, N2, and N3 if you like. You can see how with the young adults, it's a pretty regular cycle. You can see the REM sleep happening at about an hour and a half interval, and they're getting longer as the night progresses. And you can also see that the beginning of the night, they're spending more time in stage 3, stage 4, the deep restorative sleep. Compared to that, the elderly population in this study, you can see how the REM sleep's kind of broken up throughout the night. They're spending a lot more time in wakefulness. And there's only a little bit of stage 3 sleep at the beginning of the night, and that's about it. And you can see how thinking about how N3, so stage 3 and stage 4 sleep is important for restoring your body. And also thinking about how REM sleep is important for improving your mood, improving your alertness and things like that. You can see how disruptions like this can impair your sleep quality. More specifically for people with Parkinson's, on the right, the pie chart shows the distribution of sleep. So in terms of stage 2, so N2 sleep, they didn't see too many differences between the control group, so healthy elderly versus people with Parkinson's. N1 was about the same as well, but where they saw the biggest difference is that people with Parkinson's spent a lot of time awake. So that's the big slice of blue. That's huge on the one in the bottom. And you can also see that the slice of green, which is N3, the deep restorative sleep, and REM sleep, which is purple, was significantly lower in people with Parkinson's. So this is really to show how feeling tired from not getting good quality sleep. There's a reason for that. There's actually research behind, research showing that it happens in a lot of people as well. So you're not just imagining your fatigue. And
Yeah,
when
I'll interrupt for a second. So again, just emphasizing good sleep with what you've shown can help with immunity and boosting up immunity, and then also can help with cognition, right? Because it's where the memories are solidified. And so really trying to think about takeaways, it's like, you know, trying to get into that deep sleep if you can is going to help those two big things, which were, you know, really important in Parkinson's disease, but also in aging and for all of us right now.
Yep, definitely. Yeah, Julie just sent me an article on integrative health approaches to, you know, handling the COVID-19 situation, and one of the things that they listed was sleep as so crucial.
I sent her that article this morning.
Oh,
so
great! So it made its way to me. So, but yeah, I saw the piece about sleep.
Number one, actually, and I was like, "Woo, yeah, we're talking about this today." So.
Exactly. Okay, so this is also talking about how not getting enough sleep can add up. So there's this concept called sleep debt. Sleep debt is basically the difference between the amount of sleep that we it says we should get, but the amount of sleep that our body needs, basically, minus the amount of sleep that we actually get. And the difference is your sleep debt. So for example, hypothetically, let's say my body needs about 7 hours of sleep a night to feel pretty restored. If I'm only getting about 5 hours of sleep, that's 7 minus 5, which is 2 hours of sleep deficit, right? I have a sleep debt of 2 hours. The reason why I'm talking about sleep debt is this is one of those things where sleep debts can accumulate over time. So if you're getting maybe 6 hours of sleep and you're accumulating a sleep debt of 1 hour, 2 hour, if that happens for many nights in a row, it can start really adding up, and the effect of the sleep deprivation can start compounding. So in this study, this is with healthy young college students, but they found that if they only slept for 4 hours nightly for 6 days in a row, they developed higher blood pressures, higher the stress hormone level, weaker immune system, and signs of insulin resistance, which is a precursor for things like type 2 diabetes and metabolic disorders. And I bring this up because a lot of times when people come in, sometimes people are doing okay. They're getting like 6 hours, 7 hours of sleep, but they feel like it's not perfect, but they're kind of okay with it. And it's been that way for months or years, for some people, decades. And sometimes what can happen is your sleep debt can start accumulating to a point where being chronically sleep deprived becomes a new normal. And this is not to say that, this is really just to say how sometimes what you're feeling as fatigue that you might be attributing to Parkinson's or some other health condition might be amplified by a chronic sleep deprivation. So this is really to show how even if you feel like there isn't much that has been helpful with your sleep, if we can get you to start paying off some of these sleep debt, getting your sleep quality better, sleep duration better, you might start noticing some changes in terms of energy level, mood, and also immune system functioning like we talked about before. So we talked a lot about what's not good about how sleep is with Parkinson's or with age, but we'll start talking about how to make things better. So this page is talking about benefits of sleep. I feel like a lot already know a lot of these different benefits of sleep, but just to go over, getting enough sleep, getting good quality sleep can help with controlling your weight. It can reduce risks for health issues like heart disease, stroke, and diabetes. It can improve our focus, our memory, improve our mood, reduce risks for depressive illnesses. Washes the brain. So I like to explain this one in detail. Within your brain, you have what's called ventricles, which are almost like rivers that go into the deeper structures of the brain. And these ventricles basically give access to your brain cells, nutrition, and things that it needs to function. When you are sleeping, those rivers basically expand a little bit more, so the fluid can go to the deeper structures of the brain and helps with basically washing the brain. And I bring this up because sometimes people think of sleep as a passive process, like you're just turning off your body. But as you learned from the different stages of sleep and also through how the ventricles work, sleep is actually a very active process. So it's really important that we're getting good quality sleep. And again, good sleep can improve your immune system and also reduce your inflammation. So going back to this page about how do we treat sleep, we'll be going through the 3 categories that I typically go over with people. So pain management, circadian interventions, and cognitive behavioral strategies for sleep. And we'll be doing it in a clockwise order. So we'll start with pain management. So when it comes to pain management, the first thing that I usually go over with people is sleep positioning. It's hard to give a general advice on what is the best sleep position because it is affected by so many different things. Whether you have low back pain, neck pain, if you had shoulder injury, hip surgery, knee surgery, whatever it is. Depending on your personal situation, your best position is going to change. But in general, the best position for a good majority of us is sleeping on the back. That tends to be the most supportive position for the spine. So if you look at the graphic that says good sleep position, at the very bottom, sleeping on the back with a little bit of cushion or bolster under the knees, that tend to help with alleviating pressure in the pelvis. So that typically is a good modification for most people. The other thing about sleep positioning is making sure that the mattress that you are using is giving you the right support. So all of us have different neutral positioning for the spine, and all of us have different contours on our body. So there's no one mattress or one positioning that's perfect for everyone, but it's a matter of finding something that's not, the mattress that's not too firm, not too soft. If you look at the bad sleep positioning on the right, the top picture with the mattress, if it's too firm, it's going to basically shift your body upwards and downwards, and it's going to give you some pain. And if it's too soft, if it's sagging too much, then you also get that bend in the spine where it's not neutral. And what's happening when your spine's not neutral is that your muscles around your bones basically tighten up, trying to keep your body in the neutral position. But if your muscles are tightening up all night long, in the morning when you wake up, you're going to have more stiffness, you're going to have more muscle soreness and things like that. So when it comes to sleep positioning, it's a matter of changing your sleep setting, whether it's your pillow, your bolsters, your mattress, so that your natural spinal positioning is supported. Thanks. Another thing that tends to happen is, in general, I think most people that I see, regardless of age group, regardless of conditions, tend to use a pillow that is pretty high for their neck, things that push their neck forward. And that can actually lead to, it basically promotes more of the forward head positioning that can be painful for posture, can be painful for the neck. And a lot of times when the neck is too far forward, the weight of the head travels all the way down to the low back. So sometimes neck positioning can be related to low back pain conditions. And so one thing that I typically recommend is to, if you are sleeping on your back, to make sure that your pillow isn't too high. Now, the question of what's too high, what's too low is a little bit of a tricky one. It depends on the person. But what I typically recommend is try standing up as tall as you can, usually against a wall or something, and see how far your neck is. And that's probably the amount of support that your neck needs, even when you're lying down sideways. And then we can slowly adjust your pillow height from there. In terms of the different pillows, I know some people use cervical pillows, memory foam pillows. There's a lot of different types. In the end, it's a matter of personal preference. One that I found to be the most flexible and most versatile are ones that have latex fillings. So that's the picture on the bottom left. And you can see inside those are little shreddings of latex, I think. And what you can do with this kind of pillow is, if you get one that comes with a zipper, if you unzip it and remove the filling, you can adjust the height of the pillow. And I found that to be the most helpful because people can actually experiment with the pillow height, experiment with the pillow shape. That way, really the only way to know if your pillow height is correct is to change it and see if it feels better. And so instead of having to buy 5, 6, 7 different pillows, you can get one of these and start adjusting the height. The wedge that's right above the picture, that's for if you have reflux, or if you have sleep apnea, sometimes positioning like this can be helpful in improving your sleep. Exercises for pain management. So this, again, really does depend on your condition, whether it's back pain, neck pain. A lot of times when people are coming in and they have pain that's interfering with their sleep, we'll go over some yoga positioning, strengthening, stretching plan for use at night. So sometimes we'll have exercises to do during the day, and then at night when their pain's about to flare up, or if it did flare up, we might have 3 to 4 stretches that they can do to help go back to sleep. And this is more just general pain management strategies, but pacing and ergonomics. So pacing is this idea that if we keep pushing and pushing and we pass our pain threshold, it takes longer for your pain to come back down. If you ever had pain, you might notice that on days when you do too much at night, your pain might be higher. And that's kind of referring to this. If you look at the chart here on the right side, the deep blue line is an example of someone who didn't pace, they're overexerting. You can see that the pain level can start from around a 2 out of 10, go up to a 4 out of 10. If you keep pushing, it might spike up to a 9, 10, and stay up there for a while. But the person that is the light blue line, around 4 out of 10 pain, they started resting or stretching, and the pain came back down, and they're kind of pacing themselves throughout the day. Pain management can also mean getting more movement. So if your pain is exacerbated by staying still for too long during the day, if you're not getting enough movement, pacing your body by getting more movement, that can be helpful at nighttime as well. So you won't have too much sleep left over too much pain left over from the day. In ergonomics, I work on changing people's chair positioning, computer setups, whatever it is to make sure that it's easier to keep a good posture throughout the day. So that's a summary of pain management-based interventions. And next, we'll be talking about circadian interventions. So the first step to managing your circadian rhythm is just to go through a routine analysis, see what's going on. So this is when I have people keep a little log of what they're doing during the day, just a summary of what their daily routine is like, weekly routine is like, kind of analyzing how you're spending your time. Usually when people have poor sleep at night, there's some sort of napping happening during the week, which is okay. I think naps are a great tool to make sure that you're safe, make sure that you're getting some rest. I think naps have their benefit too if done with preparation and intention and whatnot, but analyzing your napping routine. And condensing nap time, that's something that I've been doing a lot more recently, where if someone comes in and if their nap time is different from day to day, like some days you're napping at 10 a.m., some days it's 4 p.m., if it's fluctuating a lot during the week, that makes it very difficult to establish a consistent sleep routine, as you can imagine. So condensing your nap time, what that means is creating some parameters around what your nap time is going to be. I'm working with someone whose nap basically range from anywhere between like 10 a.m. to 6 p.m. It would change from day to day because her nighttime sleep was inconsistent. But we're working on condensing when naps happen so that her biological clock stays a little bit more regular. And that really helps with creating more regularity with your sleep-wake cycle. And part of this routine analysis is incorporating stimulating activities. So sometimes if you are changing your sleeping routine, it can become hard to stay awake, whether around 3 p.m., 4 p.m. So making sure that you might spend some time exercising around that time. Or maybe you'll schedule some social activities during that time, phone calls, video calls, whatever it is, so that you won't be sitting down, or you won't be watching TV, which might make you more likely to fall asleep when you're trying to avoid taking a nap at that time. Another part of your circadian rhythm interventions might include exercise. So 150 minutes of moderate intensity exercise a week has been shown to improve your sleep quality. So moderate intensity exercise, what does that mean? I think the easiest way to gauge that is to think like if you are exercising and you can talk but you can't sing, if it's difficult to sing, that's usually when you are hitting that moderate intensity range. Most of the research is on aerobic exercise as being beneficial for sleep. Initially, there was some research on how exercising too close to sleep might interfere with sleep, but there's also some research saying that that actually isn't the case. So in the end, I think boils down to personal preference. Whatever exercise routine works for you, the one that makes you consistent with it is what's best for you. Part of circadian rhythm interventions is light exposure therapy. So on the right side, you can see this little graph. And so if you think about your circadian rhythm, what it is basically changes in your hormone levels throughout the day. So as you can see, as you get closer to nighttime around 8 p.m., 9 p.m., you see this the dotted line, the melatonin level, your sleep, that's going up towards, going up as you are approaching bedtime. And then that allows you to fall asleep. And then towards the morning, that level falls back down. And then that's when you wake up. And you can also see that your body temperature basically mimics that in a reversed way there. So this is part of your circadian rhythm. It's your body's natural drive to fall asleep at a certain time. Now, the thing about the circadian rhythm is in some people, this can become shifted. So instead of the dotted line, the gray part starting at 8 p.m., maybe it doesn't start until 1 a.m. So that's a delayed cycle. Or maybe it's a lot earlier. So instead of waking up at 8 a.m., your body's waking up at 3 a.m. every single day. So that is an example of a shifted circadian rhythm. One of the ways to help reshift and readjust your circadian rhythm is by adjusting your light exposure. The reason why this works is when your eyes look at light, your brain basically processes it and says, okay, this is morning time. I should be awake. So it basically helps regulate your sleep cycle. So to shift your sleep drive, to shift your sleep cycle, you can either do light in the morning or light before sleep. It kind of depends on what your circadian rhythm is doing. And you might think like, oh, I'm getting enough light. I have my lights on in my room. Our eyes are actually really good at adjusting to different levels of light. So indoor lighting can be as low as like 100 lux, that's a unit of light, or less. But if you are outside, it can be up to 10,000, actually a lot higher than that, if you're looking at the sun or the sky more directly. So when it comes to light exposure therapy, we're talking about a significantly higher amount of light. A lot of times people will do this without having to buy anything. So sometimes it might include just going outside to the yard or going out close to the window and looking out for 5-10 minutes. But sometimes that's enough for getting the benefit of light exposure. For some people, they opt to buy what's called a light box, which is it's like a rectangular thing with lights in it, and you'll set it up in front of you. You can read if you like, you can watch something as you are getting your light exposure, but that can also help with shifting your circadian rhythm. The thing about these light exposure therapy is if you have any sort of eye conditions, you want to talk to your doctor, make sure that it's okay. And also light therapy, it's only effective if the primary reason that your sleep is off is because of your circadian rhythm also being off. So it doesn't necessarily work for everyone. It doesn't mean that everyone should get a light box. So it's kind of situational, but it's one of those things that you can do. I think if you are having a hard time falling asleep at night, spending more time in the morning, getting more light exposure. So even if it's just sitting by the window and reading a book, that can be a good way to tell your brain, hey, it's morning at 8 a.m. This is when I should be awake. And that might help improve your sleep quality overall. And the final category is CBT for insomnia, so cognitive behavioral strategies. So this is a list of basic sleep hygiene and stimulus control. Stimulus control is a phrase that we use in cognitive behavioral therapy for insomnia. basically meaning that you are trying to retrain your brain to sleep in bed. So some of the things that can help with sleep include keeping your room cool, dark, and quiet, limiting daytime naps, dedicating your bed to sleep, and monitoring caffeine, alcohol consumption, not eating too close to bedtime, especially if you have reflux symptoms, limiting electronics prior to bedtime, but this again depends on light exposure plan. So if you are trying to get more light during bed, close to bedtime, that might not apply to you necessarily. Establishing a relaxing wind down routine, practicing sleep-inducing mindfulness techniques. And if you have a hard time sleeping after 20 minutes, getting out of bed and engaging in relaxing activities. So the last one, the reason why this is important is the longer that we spend in bed awake, the brain starts associating the bed with wakefulness. And our brains are really good at making these associations and making these connections, basically, contextual connections. So if you spend too much time in bed awake, it can really interfere with your overall sleep quality. So, and with the so the last strategy is really if you are having a hard time falling asleep, if you can get out of the bed safely, into a chair, or go to the living room, whatever it is, do some relaxation techniques, read some books, or engage in some wind down routines, and go back to bed when you feel sleepier. That's going to be better sleep hygiene for you. Sleep belief and worrying. So there is some research on how the attitudes that we have about sleep can impact our sleep quality as well. So for example, excessive or persistent worry about consequences of poor sleep, worrying about losing control over your ability to sleep, worrying about how the next day can get ruined from a poor night's sleep. These are some examples of beliefs or worries that can interfere with our sleep. The thing about these sleep beliefs is that it's not necessarily that these statements are false. It's just that the associated worry and reduced sense of control can be harmful to sleep. So what does this mean is if you are the type of person who tends to worry about things, tends to be anxious about certain things, you might want to start thinking about, what are the impacts of these thoughts? Like what do I believe about sleep? What am I worried about sleep? And how does it make me feel when I think about sleep or trying to get better sleep? And if you're finding that you tend to worry a lot about sleep, we can work on working on retraining the thought patterns, trying to work on relaxing our body, because when we are worrying, what's basically happening is our stress system is turning on. And when the stress system is turning on, stress hormones are being released, and that can interfere with our sleep. So in the end, it's about knowing this health information is important, knowing the importance of sleep is important, but also approaching it from a place where you're being patient with yourself, kind of acknowledging that change takes a long time. It's okay if it doesn't change overnight. And yeah, trying to keep an optimistic outlook on things, although it's easier said than done, obviously. And then sleep logging. So this is the part that I spend the most time in session, where we take a look at a person's sleep routine. We usually do it for a week or two. This helps me get a better feel for what their sleep cycle is like. And with this, I can help. I work together with the client to come up with a new bedtime, wake time, kind of making a plan for retraining the body for sleeping better at night. It takes a little bit more explanation. It's really individualized. So I just wanted to mention it briefly as an option of what might work for you, but I would definitely recommend to do this with some sort of guidance. It's not too easy to do it by yourself. You want to make sure you're not depriving yourself of sleep too much, because that can make things worse for you. So this is more of a reference for you. Okay, we'll wrap up with mindfulness and relaxation strategies. So this is part of the cognitive behavioral therapy for insomnia. This is talking about how within our body we have the autonomic nervous system, which is your relaxation and your stress response. On the right is your stress response. On your left is your relaxation response. When we can activate our relaxation response, it helps with our sleep induction, which is what a lot of these mindfulness strategies are about. And so there's a lot of ways to relax the body to help it fall asleep. This is just a list of 5 of them that I most typically use with people. Diaphragmatic breathing, that's deep breathing that is shown to activate your relaxation response. Body scan, that's a type of meditation that focuses on different sensations in your body. It's a grounding meditation strategy. Progressive muscle relaxation, this is similar to a body scan, but instead of just observing the different sensations in your body, you're squeezing your muscles as tight as you can for 5 to 10 seconds and then releasing it. This tends to be helpful for body parts that are holding a lot of tension throughout the day. Guided imagery, this is when you are imagining that you're somewhere relaxing. And the more vivid your imagery is, the more effective it is. And now there's a lot of online resources for sleep stories, which is basically bedtime stories for adults. And some people really like listening to those and helps them fall asleep. When it comes to relaxation and mindfulness strategies, I find that it's a really personalized process. So some people love body scans, some people can't stand them, some people love sleep stories, some people can't. So it takes a little bit of trial and error, but I do have some resources at the end that you can take a look at. The basis for a lot of the meditation strategies, the mindfulness strategies, is diaphragmatic breathing, which is belly breathing. So this is a little diagram on what that looks like. So the diaphragm is a muscle that's underneath your lungs. And when they contract, it goes downwards. It helps the air come into your lungs. Your belly moves out. So that's the image on the left. And when you breathe out, your stomach suctions in a little bit, air comes out through your lungs. And when you are doing your diaphragmatic breathing, what's happening is it's stimulating your relaxation response, which helps with falling asleep. So when you're trying to fall asleep, I typically recommend doing some deep belly breathing when you're lying down and to choose a point of focus. So sometimes people like to focus on counting. So they might count 1, 2, 3, breathing in, 1, 2, 3, 4, 5, 6, breathing out. The counts can be anything really. It could be 3, 3, 4, 8. You can choose your own. Sometimes people like to focus on the sensation of the breath. So breathing in, focusing on the air coming in through the nose, the changes in temperature there. And as you're breathing out, focusing on the sensation of air rushing out through the mouth. Those points of focus can really help with keeping your mind from wandering off into different things that might keep you awake for longer. And then you can do this every 1 to 2 minutes, you can shift positions. So those are some strategies, and this is a list of online resources. UCLA has a good online meditation list of meditations. YouTube has really good relaxation audios, and Headspace, Calm, and Insight Timer are some phone apps that are also pretty useful for those things. All right. Any questions?
Well, I think that was really helpful. And we'll see, I don't know, let's see if we can find the question somewhere here. I guess if we stop sharing, then maybe I can find the questions. I don't know. Yeah, okay, cool. So there's a chat here. So one of the questions is, can the need to urinate interrupt the sleep pattern, or does it naturally happen at the end of the sleep cycle?
I believe it can interrupt. That's a great question, actually.
I can weigh in if you want.
Yeah, please. That would be great, actually.
So it's I mean, Parkinson's patients have issues with, you know, the need to, the bladder doesn't retain very well sometimes and gets a bit hyperactive. And a lot of the times at night when you're in these sort of sleep cycles that are lighter and it's sort of closer to being awake, sometimes you can get triggered. In the deeper sleep cycles, usually the need to urinate is not as felt and is suppressed in the normal functioning body, you know, in a younger person, for example. I think generally people are able to make it through the night because they're getting into these deeper stages and REM sleep more. But when you're sort of have a lot of the sleep cycle be in these lighter stages, so stage 1, stage 2, and even into awakeness, which you see is quite predominates in some patients, that need to urinate sort of is felt more. Sometimes people also have a bad habit of, you know, staying awake, getting bored, eating, drinking, and then having this process of going to the bathroom to urinate and then having a process of doing other things. And so there's sort of these habits and these cycles that also people get into. So I think it's a combination of disrupted sleep into the lighter sleep cycles, a bladder that's possibly a little bit more hyperactive, and then sometimes habits that we get into. And so we can try to control some of these things around the habits, if possible, not to eat or drink at night, trying to minimize fluid intake after 6 or 7 p.m. Some people tend to drink a lot because they realize that they should be hydrating, start to drink a lot towards the evening, and then feel the need to pee all night long. So I think those are issues. Some people with orthostatic hypotension, so this thing where the autonomic nervous system gets disrupted, when they lie flat, the flow of blood back into the heart and the kidneys cause people to urinate. And so that population where people drop their blood pressure when they stand up are more at risk for having issues with peeing at night as well. So that's one thing. Andrea, wanted to thank you for the tips on the pillows. So that's cool. Just one or two other comments and people can write more questions while we're sitting here chatting here. I think with Parkinson's patients in general, making sure that your medications are working. Give me 1 second. Hold on 1 second. So can you hear me? So in general, we should be taking medications throughout the night and possibly as well. So some people can take Sinemet long acting just before they go to bed to try to move better while they're sleeping. And sometimes that can help with sleep quality at night. The sense that people are sleeping like a log or not moving and sleeping is actually not a good thing. With Parkinson's patients, sometimes people have difficulty turning and moving in bed, and that can affect sleep quality as well. And so we want to try to talk to our doctors if there are issues with turning in bed. Sometimes that can lead to people getting poor quality of sleep at night as well. And so trying to think about the wake time is important and taking medications, you know, on a very consistent basis throughout the day, possibly talking to your doctors about using something like long-acting Sinemet at bedtime to help with mobility at night is also helpful. And then just to reiterate that sleep is very important in general with detoxing. So there's a sense in the integrated medicine literature that proteins that are abnormal that deposit sometimes in Alzheimer's disease or Parkinson's, if we get good sleep, that the cells that can actually clean out these abnormal proteins and help with progression possibly of disease. And so again, reiterating that good sleep is kind of like detox. You were talking about washing the brain. Sometimes I talk about detoxing the brain, and that sometimes even dopamine can get stored up at night. And so sometimes our patients feel good actually after a good night's sleep. They feel like they're, even before they take their first set of medication, sometimes that's a good time of day for them is when they've had a good night's sleep and first thing in the morning. There's also been a question about what do you recommend I do if I wake up in the middle of the night in order to get back to sleep?
That's a great question. So what I usually do is go through a process of identifying moderate stimulation activities and low stimulation activities. So you can come up with a list, like 3 categories: high, medium, low stimulation. And think about things that you do throughout the day and categorize them into those 3 categories. So for example, exercising might be high stimulation activity, but stretching might be low or medium. Maybe folding laundry might be low stimulation. Reading for some people is medium stimulation. For some people it's low stimulation. Podcasts, same thing. For some people it's low, some people it's high. So think about different activities, make a list, and once you have a list of low stimulation activities, think about which ones you can realistically do in the middle of the night safely, easily accessible. You don't have to worry about turning on too many lights. You don't have to worry about waking up your family members. And then you can try those things. Typically, I think that includes some stretches for some people, some restorative yoga stretches. For some people, it involves books or listening to music. Some people like to meditate or pray or any other spiritual practice. So it kind of boils down to what works for you personally. But in general, things that typically you do want to avoid are eating. You typically want to avoid if you can. And you do want to avoid too much light exposure because, like we talked about with the sleep cycle, exposure to light can really confuse the brain in terms of what's nighttime, what's morning time. So those 2 things you do want to avoid if possible. But yeah, what I would recommend is to come up with your own list of low stimulation activities and come up with a plan of, you basically have a menu list item of what you can do at night when you wake up.
And I think it's important, with our Parkinson's patients, most of us are not giving a lot of medication to our patients to be able to function really well at night. I try to get people to get a good night's sleep. So it's not a time that people should be roaming around their house and, trying to do things. So it's really a time that you want to be staying near the bedroom, thinking about these low stimulation activities and keeping, if you have a podcast or something, keeping the device, near the bedroom so we're not
Restless leg.
running around all over the place. So there's been a question about weighted blankets. Do you have any thoughts on this?
Yeah, again, the research on weighted blankets is it's emerging research. It's not high quality research, so I don't have a strong opinion on them. But from a sensory standpoint, they are a relaxing sensation. So yeah, well, so the weighted blankets, the theory behind them is with the weight, what it's doing is it's deep pressure sensation, which is found to be like a relaxing sensation for most people. And so they actually use it in sensory regulation therapy for kids with sensory differences. So there is some research in that field, but not necessarily for insomnia or for people with Parkinson's. I think with weighted blankets, what you have to consider is how it can make it difficult to move around in bed, especially if you have stiffness or bed mobility is an issue. So you kind of have to weigh those options. But weighted blankets can help with mood regulation for some people. So what I typically recommend is for people to try simulating a weighted blanket. So if you have a heavier blanket, if you have a bunch of like heavy pillows, whatever it is, to try putting a lot of things on top if it's not a hot day, and then see how it feels. See if it feels better, see if it calms you down more. If it does, you might want to consider trying a weighted blanket. You want to make sure that the weighted blanket is only about 10% of your body weight. You don't want something that's too heavy. Most of the research is in the 10% range, I think. So.
Yeah, and I reiterate the safety issue. If you have to get up and pee quickly and you have something super heavy on you, you might actually trip and fall on it, or it might make it harder to turn in bed. So yeah. There's also a question here about herbs and sleep, and even CBD. I think that most sleep aids we have to be careful with in our populations. Melatonin is something that we do use in some populations, but again, I would consult with your doctor because it can sometimes be you know, something that can be not safe to take. And many of the things that are even over the counter from a sleep perspective, Tylenol PM and things like that, actually contain Benadryl and other things that can make Parkinson's patients sometimes, you know, get a little confused or hallucinate. So we have to be really careful. I would definitely, before you take anything orally for sleep, you know, I would consult with your doctor would be the safest thing. I think we're almost at the end of the time frame here. This was so helpful. Naoya, I don't know if you're unusual in your OT knowledge of all of this. I think it would be helpful for people because this is, you know, a national, you know, kind of audience. Do most people with an occupational therapy background know this stuff, or are you just speaking from other experiences and knowledge bases? Can you help guide?
Yeah, not too many OTs specialize in sleep or lifestyle interventions. That's correct. But there are some OTs who do it. OT is such a diverse field that it's just because you're an OT doesn't mean that two OTs will be doing the same job. So it's a little bit tricky. But yeah, so it's basically coming out of research on lifestyle interventions that was done at USC, which is where I did my residency. So that's how I got into sleep interventions.
Okay, that's really helpful because I think I don't want people to call up their OTs and start asking them all these questions and probably not have great answers from them. I think this is really amazing that you have so much of an extra experience and background and could impart this to us. But I wanted to be honest that OTs out there in general may not all know this as well as you do. So thanks so much. So I will hand it over to you maybe for a last word, Naoya, and then back to Andrea after that to close.
Sounds good. Yeah, thank you everyone for listening in. If you have any questions, if you are in California, if you are in Los Angeles, we are doing free online consults for OT at this time. And so you can contact us for that if you like. We're also doing group classes, trying to keep people engaged and busy because I know I'm missing my in-person social interaction. So trying to find ways to keep people connected. And I think support groups are a great way to do it as well. And it's so good to see that so many people joined today. So yeah, thank you again for the opportunity.
And we'll put some resources that you had given and maybe even post the slides if you're okay with that, because there's so much rich information to share, not just with our Parkinson's community, but with everybody that we know, I think, right now. So thank you. And Andrea, back to you.
Great, thank you. Yes, we'll post the recording and the slides and put some of those resources so people can find out, you know, how to contact Reactive where you practice and be able to maybe go back and review some of those slides. They were great. So thank you so much for joining us to share all your knowledge about sleep, and thank you again for Dr. Subramanian. It's such a perfect combination where we have a subject matter expert and then a neurologist, so we can have a really well-rounded picture of these topics. I'll leave you with a teaser. On Wednesday, we're going to be talking about resilience. I'm really excited about our expert speaker for that. Dr. Julia Elaine. She is, she's in Canada. She's actually a sports medicine doctor. She works with Olympic teams and Olympic athletes and has some great research, some fascinating research on, you know, what makes certain athletes bounce back from injury. And the great thing, even for those of us who aren't, you know, competing in Tokyo next summer, is, you know, the same lessons that she learns working with her athlete population, she brings to all of us, you know, the same thing that elite athletes, you know, experience, you know, we can use on a day-to-day basis. So really excited to have her join us on Wednesday. So that's going to be Wednesday, April 1st at 12 noon Pacific. We hope that you all join us to learn something, you know, get the brain chugging, and also be able to see all of our audience's smiling faces out there. So thank you again for joining us. Bye, everyone. What do you think? You guys learned something? Are you excited? A refreshing night's sleep ahead of us. Gonna, maybe take a look at some of the bad sleep hygiene that maybe I know I will, that I've, tended towards, and do some course corrections. So absolutely. Well, thank you again, everyone. And we hope to see you on Wednesday. Bye now.